This is something basketball players deal with all of the time, and it's recovering from tweaked ankles. We see it. Have you sprained your ankle? Don't baby it. Blood flow is your best friend. Now, this one comes from Amanda, I suppose a women's basketball player, welcome, in Des Moines, Iowa. And she asks, what's the best way to recover from a tweaked ankle without losing weeks of progress? Now, just as a caveat, a catch all for everything here, I'm not a doctor, right? But I've dealt with enough rolled ankles over the years to know what works and what doesn't work. So, first, motion is lotion. Unless you're dealing with a severe ankle sprain, complete immobilization of that ankle usually delays recovery. You need to move the ankle safely, circles, gentle pumps, controlled flexion, things like that, just to keep circulation active in that area. Now, second, I'm a big fan of compression and voodoo flossing, right? Once again, nudge or shout out Kelly Starrett, right? With the voodoo flossing, wrap that ankle tight, limit some blood flow for a short time, then release it and flood that area with new oxygenated blood. That surge of circulation helps clear waste and it speeds up recovery, right? There's some really good efficacy around blood flow restriction, i.e., kind of what the voodoo floss bands do. Now, third, maybe getting some old school Epsom salt soaks, right? It's old school, but it works. I'm telling you, it works. It reduces swelling, it relaxes the tissue. Also, just feels great. And then finally, elevate it when necessary, but don't become passive. Don't elevate it at the sake of moving it, right? The goal is to control inflammation while continuing to drive blood into that tissue. Because the faster that you restore normal movement patterns, Amanda, the faster that you'll actually regain stability, proprioception, and confidence in that joint. So appreciate the question. Awesome one, something that I'm sure a lot of basketball athletes are going through right now. Somewhere across the NCAA, across women's basketball, somebody in America is dealing with an ankle sprain. So great question.